Okay. Hi, everybody. My name is Meredith Cloud. I already noted I got the number for the class wrong, so I apologize for that right off the bat. I am a student physical therapist assistant, and today I'm going to be talking about hemophilia and some of the genetics behind it and how physical therapy can help people that have it. So to give you guys a base, hemophilia is an X chromosome linked bleeding disorder, and it's almost completely inherited by men. Women, are pretty much oftentimes the only carriers. Like, I love this diagram that I found. The father has hemophilia, the mother does not. The sons both are normal and aren't carrying the gene, but both daughters would end up carrying it. Well, there's a 50% chance that the child would end up with it because it's X chromosome linked. Only boys are the ones that end up as the actual people who are really affected by it because it's linked just strictly with the X chromosome. So since boys have the X and the Y, if it ends up on the X, they end up with it. So there's a 50% chance that a young man will inherit it from his mother. And I found this interesting. There's actually also a 30% chance of just spontaneous mutation that a person can just randomly end up with the disease. So to give you some background basis a little further, there are two types. Hemophilia A, which is factor VIII linked, that's known as classic hemophilia, and there's hemophilia B, which is factor IX linked. In A, you end up with between 4,000 and 5,000 men born each year. 1 in 4 to 5,000 men, so it's a higher percentage than hemophilia B, which is 1 in 20,000 men born every year in the world. And weird fact I found out, I thought it was kind of interesting, 80% of cases of hemophilia are actually outside of the United States. Some of the more mild forms can cause slow bleeding or slower healing times, and that goes all the way up to the more severe forms, which cause brain, joint, musculoskeletal, and even central nervous system bleeds. And another fact I thought was really interesting is women carriers will mostly have half of the normal clotting factors, which is enough in normal life to not die or not have a big issue. But there's 10% that have less than normal, and they oftentimes will have bleeding issues, like especially dental surgery. They'll have issues with healing. Signs and symptoms, bleeds during surgery and minor injuries. I thought this was kind of interesting. Spontaneous bleeding is an issue that people can end up with. Just they'll randomly start bleeding for no apparent reason. That's in the more severe cases. Joint bleeds are a big issue in hemophilia, causing future problems such as the necessity for joint replacements and contracture, especially in the ankles. But the three main places where you can end up with these joint issues: ankle, elbow, and knee. And then again, slow healing times and major bleeds in the musculoskeletal system especially. So it can either be chronic widespread pain in the body or acute extreme pain during active bleeding issues. It will progress from, the progression of the disease itself is from minor joint bleeds and slow healing times all the way up, like I said before, to severe bleeds, and this progressively will get worse as the person ages. And they end up with joint lesions, bleeding, and it's a big issue right there. And like I said, they can develop contractures and will probably need a joint replacement at least once in their life. So prophylactic and medication treatments, they will do intravenous IV drips of either factor VIII or factor IX, depending on which version you end up having. I found this kind of interesting. There are two different ways that you can receive it. You can get it on demand, like if you know you're going to have a problem, you're going to be doing something that might cause it, anything like that, or for the more severe disease, people will need it 2 to 3 times a week to make sure that their bodies can clot and they can live a relatively normal life. It's advised to avoid NSAIDs because that, thins the blood and will cause bleeding. And in worst case scenario, opioids are used to control the pain because it can be that extreme. Okay, so physical therapy and how it's used to treat hemophilia. It's used to slow the progression of the disease, strengthen, increase balance, and promote healing, especially in the joints. The healing phase is how we determine what sort of physical therapy is the best for that moment. We discussed it in pathology, acute, subacute, or chronic pain or healing phase, and so I broke it down into that. So in the acute phase, there is generally, it's either directly post-surgical or there's an active bleed going on somewhere in the body. So there's a lot of pain. There's especially limited strength and range of motion. And in this phase, it's non-weight bearing or toe touch weight bearing, so as not to aggravate the bleed or put more pressure on it than is absolutely necessary. They advise RICE, rest, ice, compression, and elevation, and immobilization, bed rest, or splinting to avoid use of the joint or the musculature that's affected. And the overall goal here is to prevent further injury or bleeding in the area that's already affected and to allow it to heal as best it can at that moment. Subacute, what the recommendation there is, you're starting to be able to do a little bit more, and there will be a baseline of pain with people who have hemophilia, so they want you to be able to do your activities of daily living as best you can with no increase in pain. They recommend active assisted range of motion or isometric strengthening to start to get that musculature working again, because a lot of people will have been not using it, so there's potential for atrophy. A big thing is stretching. You need to make sure to keep those muscles long and lean, but a big thing is you have to instruct your patients in not overstretching, because that can cause bleeds again. And the goal is to begin working towards healing, but not to re-aggravate anything else. And in the chronic phase, the big recommendation is to prevent future issue or minimize the chances of hurting yourself again. So they do a lot of proprioceptive and balance exercises to reduce, falls or the potential for somebody to bump into something, or, because a small bump can cause a big bleed. Shouldn't increase pain, and it's real big in stretching, active range of motion, and progressive resistive exercises in order to increase strength and to help people from, hurting their joints further than they absolutely have to. So it's important overall, in conjunction with other medical treatments. The IV drips help to slow the progression of the disease, but they've been found not to completely stop it. In conjunction with physical therapy, you can help to affect that and make it, slow it even more so. Other forms of physical therapy used with treatment: hydrotherapy, TENS, massage, cryotherapy, home exercise, and to make sure to teach your patients proper techniques to use during ADLs. Again, with the massage, you have to be careful not to be doing real deep tissue, because obviously that could cause further bleeds. But the big thing is they can go on to live a normal life. They just need to be aware of how they do ADLs. They can do sports if they want, just not contact, and just work on living a normal life without hurting yourself, and making sure you keep strong and healthy. The end.